The Inland Empire Health Plan and Healthy Heart Nation have partnered for this series to discuss the importance of heart health in the African American community. Leading this conversation is Kenita Bourne, a licensed clinical social worker and the manager of social and community services at IEHP, and Dr. Columbus Batiste, a board-certified interventional cardiologist. Let's join this conversation where we will dive deep into crucial topics and provide you actionable tips to help you and your loved ones live heart-healthy lives.
Okay, Doc. So we talked about how we can alter our lifestyles to have better blood pressure control.
Yeah.
But I'm sure there's going to be times where people might have to take medication to manage their blood pressure. So what are some things that they should know, or we should know, and think about when we're considering medication to manage blood pressure?
Yeah, no, it's such a great question. I mean, oftentimes we look at, if I have to take medications, it's a scarlet letter, right? That, something's wrong with me and I don't want to be like that. And people may even have judgment that's passed on you, or you just don't want to simply take it. But it's so important, as we've talked about previous segments, about the importance of lowering that blood pressure. And everyone is different. So some people are going to have a tremendous response to all the lifestyle efforts and doing things and really can markedly change. Others, they're going to need the combination of both. And so it's okay of finding what's just right for you. The first thing I tell every patient is understand it's important that we are following a recipe that can lower your blood pressure and decrease your risks. And what do we want? We want to stay healthy. We want to stay away from having heart attacks, strokes, kidney failure. So in order to do that, we have to follow a recipe that's going to help us increase our odds of reaching that goal. That means I need my numbers to get low. So it's not good enough just to be on the medication and have your blood pressure still high. It's important to take the medication and then inspect what you expect.
Got it.
I expect my improvement in my numbers. I'm not seeing it. Why is that? Is my dose not high enough? Is this the right medication for me? So I want you to go back to your doctor or your provider, your nurse practitioner, and say, hey, my numbers are still high. What's next? What should I do next? We want those numbers. You're shooting for an optimal. I want you to get an A in health. I don't want you to get a D. I don't want you passing with a C minus. I want you to get an A. And that means we need to get the prescription just right. So I expect you, every medication won't fit. So just like you go to the store and you may buy a size whatever dress or pair of pants, and you're like, I don't like the way it fits. You're going to just keep it and keep wearing it? Now you're taking that thing back, aren't you?
Yeah.
You're like, oh, this doesn't fit. I need you to kind of get me the one that fits or get me a different designer maker, right? And you're going to find the right brand for you that fits. And you're going, okay, now this is fitting just right. Same thing with your medications. You want to have an open dialogue with your doctor. Because remember, guess what? I work for you.
Nice.
You don't work for me. I work for you. You're the CEO of your business, your corporation. I'm consulting. You're paying me to consult, which means guess what? I need to provide you with the information you need to make the best decision for you so you can live the best life ever.
I love that. And as you're talking, the thing that I'm thinking about is I have to take ownership of my health.
Yes.
Right? So it's not enough for you to give me a medication and I take the medication and not think about my blood pressure again. I'm still now responsible for trying to have a healthy lifestyle.
Yes.
I'm still responsible for checking my blood pressure on a regular basis. So when I come back to my consultant,
That's right.
I can say, hey, this is what my blood pressure has been looking like. I know that you said you gave me this medication, you wanted me to try it out, but it doesn't seem like it's doing what we wanted to do. I love that.
That's
so
right.
I'm responsible.
You're completely responsible. Now, people may not like it, but the reality of it is I estimate 10% of health is achieved in the doctor's office. 90% is at home and in the community. That means that the responsibility is in our environment. It's what we do on a regular basis, how we choose to live life, how we choose to take our medications, how we choose to communicate that back. And I want everyone just to empower you in this moment, right? To empower you that you're important and you matter. And so that means that your health matters. And what you do with that health in your body and that corporation called your body, right? It's up to you.
So I am the CEO of me.
You're the CEO of you. That's right.
Nice. Thanks, Doc.
You got it.